We're live. It's the Dr. Kris Podcast. Dr. Kris, how are you?
Good, Steve. How are you doing today?
Doing well. It's kind of windy where I am today. Um, the weather's been kind of warm, you know. How about in Weatherford?
Yeah, it was 90 degrees or 91 or something like that yesterday. Like, that's ridiculous for February. I mean, it's nice, but I hope that's not a foreshadowing of our summer.
Yeah, exactly. All right. Today we're talking about injectables as a solution for premature aging. We're going to run our intro and then we're going to talk about all the things that you guys can do to help us look our best. You ready?
Go.
If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life Podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris Podcast. All right, lovers, you're in the right place.
In the bathtub. We have to start every podcast off with making a comment about the couple in the bathtub with their robes on.
All right, injectables. This is an area that I'm not real familiar with. Maybe you can obviously tell, but there are some folks out there that really are interested in this topic. There's I see it on Instagram and Facebook and places, a lot of conversation going on. So what's the scoop, Dr. Kris?
Yeah, so, what I thought we would just kind of dive into some things that we get asked a lot. And, I think one thing is a lot of people believe it's a female only procedure, which is simply not the truth. Certainly, like I've joked, I don't mind saying I've been getting Botox for about 12, 13 years. You don't want to see, actually the staff is funny whenever so Botox is an injectable toxin that we use in microscopic amounts to paralyze muscles. And we generally use it from the cheekbones and up. We might use it around the mouth occasionally, but for the most part, for simplicity, let's think of it of cheekbones and up. So, for those lines and wrinkles and things like that, especially when we get emotional and raise our eyebrows, you can get that real furrowed brow or angry look, especially, like some of the ladies call it RBF, resting bitch face. But it's funny because my staff will come in and say, hey, you're on the schedule today. They'll tell me a couple things. Hey, you're on the schedule for hormones today because you've been agitated lately, or wow, we got to do something about those lines and wrinkles. And so I'll be on the schedule for Botox because, I have a big forehead. And so, you definitely don't want a lot of lines and wrinkles with that because, as we start to age, really, if we could even back this up and say, okay, what's most important as we age? Injectables can be used to try to fix aging, or they can be used to try to prevent skin aging, and we have a lot of younger patients. And that's kind of like, I saw a post by one of my colleagues up in Michigan, and she posted, there really is no age as an adult that's too young to start some of these different injectables. Now, obviously, 18-year-old rolls in here, they probably don't need it, but we do have 20-somethings that start to need our services because they realize that a few of these preventive procedures can actually cause them to look young as they age. With anything, as we always talk about, I really don't pick any topic that we talk about. The best way to approach that topic is prevention, right? Like if we can just prevent something from ever happening, that's the best way to go about it. Like that's why we always say, let's prevent insulin resistance so we don't become a diabetic. That's better than becoming a diabetic and then having to reverse type 2 diabetes. So a lot of this really starts with, I think we would just be not doing a people a service to say good skincare, protecting the skin. When you go out in the sun and you know that the sun is bright and it's hot and the UV rays are intense, to wear sunscreen, wear caps, wear hats, protect our skin when we're young. It's the time that most of us are least likely to protect it because we're young and we don't really care. We're not thinking about our aging, because not only aging, but that's how you can get skin cancer, and melanoma in particular can be quite fatal for some people. And so, we help lower the incidence of these things by protecting the skin. So I always like to say, let's not forget about good quality skincare. Here at Research, we mainly sell Zoe and Image, which is amazing lines of skin products. We've talked about them before, and we do free consultations if it's just a person looking for a skincare regimen. And then hydrofacials, actually getting some of that dead skin off the face. Doing that on a routine program can do a lot with slowing down and making our skin look better and slowing down aging. But despite all that, some of us do need the injectables. And, I really break injectables into two categories: muscle paralyzing agents and fillers. Here at Research, we're an Allergan exclusive clinic. That's something I've decided in the past to do. Allergan's the maker of Botox and the Juvederm line. In my opinion, they're the Bentley of injectables, and I only like to use the best of the best. And I think that's why we have stayed exclusive to Allergan. There's certainly competitors to every filler. I think there's little small nuanced differences between them, but at the end of the day, they're all quite similar. And I just chose to stay with what I consider to be the best and the longest running out there. So again, Botox is an injectable that we can use from the cheeks up. We inject them. They're practically painless. And you're going to get paralyzation of those muscles for about 90 to 120 days. So the average Botox client comes back every 3 to 4 months. And with time, those lines and wrinkles are going to fade for most people, and many times completely go away. So you get the, more smooth forehead look without the lines and wrinkles, which that easily, like for me, I think it easily takes 5 years off of my aesthetic age. And then fillers can be used in those different areas that we need to actually fill in gaps, as our face ages, because the biggest thing, like we have a book here that I think is really good that Allergan makes, and it's mothers and daughters. And they're obviously mothers and daughters that look very, very similar. And it shows like how the face ages, and we start to lose cheekbone structure as we age. And as our cheekbones start to regress, in addition to poor quality of skin, that's why we start to get the sagging. And that's where we start to get the lines and wrinkles. So a lot of times with injectables, we go after the cheeks to actually rebuild the cheekbone structure, and that gives an upward pull onto the face. You might call it like a mini facelift, to try to help with getting rid of some of those lines and wrinkles.
So when we talk about injectables, and I am assuming you do it from the cheek up because you don't want to paralyze the smile muscle. Is that why?
Yeah, well, these muscles here are really too big. And so the only time that you're going to use Botox, and really more non-cosmetically, like you can inject into the jaw for like TMJ. So somebody that grinds their teeth at night or has TMJ, it'll relax that muscle. Sometimes we'll use them for the little fine lines around the mouth for like what we call smoker's lines, but you don't have to be a smoker to get them. Actually, straws cause them too. And so, because those are little bitty muscles that we can inject, but for the most part, Botox will have minimal effect because this is more loss of volume, and Botox doesn't do anything like that. It's not a filler of any type. I know I break things down sometimes very simplistically, but fillers like caulking under the skin. Okay. If you want to think of it like that. So, you go caulk your sink in your bathroom, it's above it's above. Here, we're basically taking products that have been proven to be safe and putting it under the skin so that we can kind of cause things to pull up and stay with time and solidify that. And fillers last different lengths of time. Some fillers last about 9 months, some last up to about 2 years. So it just kind of depends on the area that we're doing. But you can really, with time, do a great job of reducing the aesthetic age of these patients and how they look aesthetically.
So when you say injectables, at least as far as this conversation is concerned, it's Botox only, or are there other injectables?
No, it's for us. So again, there's different competitors to Botox, but Botox and fillers are both injectables. Okay, I call injectable anything I'm injecting under the skin of the face. And again, Botox. Everybody, I always joke you probably have to be from a third world country to hear the term Botox and not at least know the term. You may not know exactly what it means, but you're like, hey, it's something you get injected into your face. And so Botox, again, is more of is a muscle paralyzer. The other reason is nothing really bad can happen from the cheeks up if you have a skilled injector, other than, that's where I come into a skilled injector. Some of the big fears people have is a dropped eyelid. It's actually where you can paralyze the ability to blink. Knock on wood, we've never had that in our practice because we follow very strict guidelines with injecting. But when you start getting down, and some doctors will use Botox in the throat area, into the neck area for some paralyzation. It's really not what we've ever decided to do. And in a hand of a skilled provider, that can go fine, but you can actually paralyze the ability to breathe and things like that and cause some real problems. So we've always been a little more conservative in the neck area in that way. We think there's probably better ways to treat it than Botox, but I'm not going to fault a doctor that does it like that as long as they're skilled at what they do. So like I said, just for simplicity, we consider Botox cheeks up, except for occasionally around the mouth. Fillers are cheek down because that's where we're really trying to fill volume. And again, that's going to be, like if I squirted Botox on your finger, it feels like water. It's that's the consistency, where if we squirted filler on your finger, it's definitely going to have a more gel-like feel to it because it's actually a filler. Most fillers are all hyaluronic acid based. Hyaluronic acid is what makes up cartilage, but this is a softer product than that. Some people I think worry that if they get filler, they're going to get, I think lips is the most common thing. Like, oh my God, if I get filler, I'm going to look like, I don't know, pick your celebrity, that you feel like has gone way too far with, pick a Kardashian or something like that maybe you think they've gone too far. And like I always tell patients, most people, we couldn't get their lips to be that big if we tried, because you have to have the structure for that. Like my wife is a good example. She naturally has large lips, and, we may use a little filler because of asymmetry. By the way, everybody's asymmetrical, even our eyeballs. There's nothing that is exactly alike on us. Our right ear, our left ear, there's differences. And one thing I always try to tell other injectors, and one little trick that was taught to me, is you should never chase asymmetry, although we all do it. In other words, you can't make one half of the lips look exactly like the other half. It's impossible. You just try to get them as close as possible. But I think that's one of the big fears is, what was that movie? First Wives Club. I don't know if you ever saw it, but she got like filler and she came out and her lips were like huge. We don't do that at our practice. We do, we really listen to the patient, see what they want. Some of our patients will treat their lips and maybe we come back in 6 months and do more. And maybe with time, we increase the volume of their lips to what they're comfortable with. Some ladies look great with larger lips. Some ladies would look ridiculous with larger lips. And, I always say, how you look when you walk out of my clinic is a reflection on this clinic, and we're not going to do something that we think looks ridiculous. We're just not going to do that with our patients. So our patients can feel comfortable that in Dallas-Fort Worth, I think that maybe the look that ladies are going for in Dallas-Fort Worth may be different than the look that they're looking for in Beverly Hills. And, we try to be very respectful of that and, work with the patients the best we can to make them look younger, but not make them look ridiculous at the same time.
Can filler be used as an acne scar?
It can sometimes, if those scars are, you can go up under those scars sometimes and I hate to use the term, but I can't think of anything better. Pop them out a little bit. Really, acne scarring, that's a multifaceted approach. Filler, if it's somebody with mild acne scarring, that would certainly be something that would be feasible. But typically, we like to treat them with a laser, first to actually try to get some smoothing out, maybe even some some dermablading or a dermabrasion, that type of thing to actually try to lessen it. And then at the end, a little bit of filler if needed to treat the acne scars. But yeah, you can treat acne scars with that. So typically with the face, we treat like cheeks, chin. These are the nasolabial folds. You can treat nasolabial folds, lips. Those are the most common areas that people treat. Again, the misperception is that guys only get, if they get anything, it's only Botox. And, certainly I would say 80-90% or greater of our filler patients are females, but guys can get filler too and do it in a very mild manner to where no one else really knows what you've done. I always say filler done well is where your friend notices you did something, but they can't pinpoint what it was until if you choose to tell them, then great. Because a lot of times ladies will come in there like, oh my God, my husband will be upset if I get filler. And they kind of do it, like, I don't want to tell him. And I'm like, hey, look, if your husband notices, good for him, because he's probably not going to notice. I always say, how many times do you get your hair cut and he doesn't even notice that? And that's a dramatic thing. Most of the time with filler, they're not going to notice you did anything. You just look more refreshed. You look more youthful. I always say, hey, just tell them you got a hydrofacial and you look younger because of that. If you really don't want to tell them. Maybe if I could also, like, sometimes patients are like, well, how long am I down? Kind of, is it painful? That sort of thing. And, nowadays, most of the filler is mixed with lidocaine. And we use topical numbing gel to numb the initial stick. And then you're going to feel just a slight burn. And then the filler is going to quickly, because it has lidocaine in it, the area that we're injecting is going to go numb. I always joke, I've been injecting now for about 14 years. And I don't know why we didn't think of putting lidocaine in the filler 14 years ago, but it used to be pretty brutal. We used to do dental blocks for these procedures. Like you go to the dentist, you go up under the gum and actually numb it. I'd actually have to do dental blocks on some of these patients to tolerate these procedures. And I hated filler back then. I was like, oh my God, because ladies would just be so uncomfortable through the procedure. Like, I felt for them. And now that we have, the lidocaine in the procedures, in the tubes, I would say that most ladies and guys, Botox is not painful. 1 to 10, that's a 2. No one should be scared of getting Botox unless you're just needle phobic. It's not a big deal. I would say filler is somewhere on that 3.5 out of a 10 range. I don't think anyone gets filler and says, wow, that was so much fun, let me do it again this afternoon. But I don't think that, because obviously they come back, it's not bad enough that they don't come back for more down the road.
Well, when we think about candidates on the men's side, you mentioned an age, beginning at a certain age, but what do you see as far as men? What are they coming in and what are they resolving and why are they wanting it?
So the majority of men are coming in usually for solely Botox, okay, because they feel like masculine wise that's accepted enough and they're not losing their man card by getting Botox. Okay. And I agree with them. I think that Botox now is so normalized in our society. No one's really gonna knock you for getting Botox, man or woman. Filler wise, probably the most common area is nasolabial folds. Right through here, because you can do a little filler there and lessen the depth of your nasolabial folds, and highly unlikely anyone's going to notice that you did that, other than like, well, I don't know what Steve's doing, but he looks a little better. They can't pinpoint that. Guys, believe it or not, a little bit of lip work sometimes occur because like my staff was telling me the other day, they were trying to talk me into it, and I just haven't decided if I'm going to proceed yet, because I noticed I've lost a lot of lip volume. If we really look at it, we lose a lot of volume in our lips as we age. So I would say most common is nasolabials and a little mild lip work, just giving a little bit of the lip volume back to guys. I'm in a fairly conservative part of America, Texas, and urban / getting to rural areas. And so, if you move to like Miami, Boca Raton, Beverly Hills, guys get all kinds of filler work done, but that's not really what I see in my practice. So just a little freshening up, but definitely Botox with some guys doing just a little bit of filler work for freshening up. Post care, it's really simple, like with filler, it's just kind of leave the area alone for a few days, letting the area, um, uh, kind of like wet concrete, although it's not really concrete. I always say you need to not walk on it for a couple days. So I always just tell my guys and ladies, please don't mess with it. Like don't go home and start mashing on it. That's the worst thing you can do because it is still soft and you can move it around. And I always say no heavy kissing or anything like that for a couple of days. Let it set up, especially if we did lips. Botox is really even easier. It's just for a few hours, not to agitate the area. Don't scratch it, don't rub it, that sort of thing, so that we don't have any unwanted side effects. Botox kicks in about 2 weeks, whereas filler is pretty immediate. With filler, patients will, and it's always funny. Sometimes ladies are freaked out when they leave because their lips might look a little bit, let's say we did lips, they might look a little larger than they really want because they're swelling. There's about 20% swelling. So I always say, well, 20% is going to go away. And every single time the same thing happens, Steve. They come back and say, I wish that swelling hadn't gone away. They walk out thinking that the swelling's bad, but then they see it for a couple of days and they like it. And then it goes away and they're like, oh, dang it, I wish I had that swelling back. And that might be where we, do more a little bit down the road. But one of the big things I wanted to push through with fillers is follow up. And I always have a saying like, you can do filler and it might last 9 to 18 months. But when they did those studies, what they meant by it is think of it like a tire. And if I have air in a tire, it simply meant 9 to 18 months, there was still some air left in the tire. It wasn't probably at 35 PSI. And so what I usually tell ladies, if you don't want to get filler, let it all wear off and then do it again. That's when things kind of become noticeable. Like, hey, Steve didn't look good last week. Now he looks good again. And I think you get more bang for your buck if you start coming in about every 6 months. And the tire is still, 2/3 full. We can do a little more with a tube or two, keep you looking more fresh and never actually letting the tire go flat. That's just an analogy I use around here is I just don't want the tire to go flat before we do it again, because then the air that we're using, in this case, the filler, doesn't go as far as it would normally. So ladies start to realize that it's more economical, better for their look, guys too, but if they start coming in about every 6 months for fillers. So Botox every 3 to 4 and fillers every 6, usually for most of my patients.
Is there any peptides that you recommend that kind of help maintain, complement that?
Yeah, absolutely. Great. I didn't even think about talking about that. Yeah. In our office, we have a pre-compounded product called Luminate. And Luminate, the main ingredient is arginine with GHKCU. GHKCU is the major peptide. Both of those are peptides. And GHKCU, a lot of people call it the Hollywood peptide. It can be injected, but in this case, we're talking about it transdermally. So it's just a topical cream you'd use once a day. And it really, really helps with, they call it mini Botox in a bottle. I think that's a little bit strong personally, but they did see a 33% reduction in lines and wrinkles and a 45% increase in collagen elasticity by using GHKCU with arginine. And so I always tell my providers, because some providers get concerned, like, oh my God, my Botox business is going to evaporate if I use this. And I say, no, it isn't that good. It's a great symbiotic relationship with Botox and filler. Again, as we age, and you and I are similar in age, and I think we're hanging in there pretty decently, but we realize it gets harder and harder to maintain a youthful look. And so a lot of my patients, I always say, hey, my best way is throw the kitchen sink at it, hit it from every vantage point we can. But we also understand some of our patients have tighter budgets than others, and we're always aware of that. And that's why we love for our patients to give us the budget that we're working under. I always joke, like the first time I ever built a pool, I was very fearful of giving the pool guy like my actual budget, because I figured like, well, if my budget's $100,000, he's just going to build me a $50,000 pool and charge me $100,000. And then by the time I built my third pool, I actually had a pool guy I trusted. And I said, hey, here's my budget, so he could maximize the pool for the budget. And that's what I always try to tell patients. Like, if you'll give us the budget, if you're comfortable enough giving us the budget, then we can truly build a program that's the best for you within that budget. And because we totally understand that everybody's budgets are different. Some people may only have $100 a month, and we can do a lot for $100 a month. We really can. Some patients have unlimited budgets. I don't have an unlimited budget, but some patients do.
Well, awesome. So if someone's been listening and they're going, all right, so this has been in the back of my mind, I've been thinking about it. All right, I like Dr. Kris. He seems to be an approachable guy. What should they do?
The easiest ways, like any of our services, is, we prefer, I'll say you can call us, 817-599-9902, and it's on the website as well. Or you can click the consultation button on the researchclinic.com and go that route. That'll route you to Lauren, our virtual employee, and Lauren will reach out to you and get you in and get you into our clinic. As far as aesthetics go, we don't charge a consultation fee for aesthetic consultations. If it's just skincare related, if you're like, I just want to see what you can do for my skin, you're welcome to walk in for that stuff. Just come on in, and usually the ladies will be more than happy to talk to you and kind of walk you through that and what your options are with us.
All right. Is there anything else you wanted to mention before we wrap it up?
No, I think you did a great job throwing that peptide in at the end. I'd have forgot about that. So good job. I think we kind of covered the basis.
Yeah, those peptides might be something you start with first, but
you can. Yeah. Again, everybody's a little different. We have some patients that are really anti. They don't want to inject anything into their face, and I understand that. I get it. And some people just don't need it. And probably one last thing I would say is the sooner you do start, like if you're in your mind, like I'm going to do Botox eventually or filler, the sooner you start it, the less you're going to actually cost yourself long-term, because we're going to be able to use less Botox, less filler, because we're going to keep the skin quality, the collagen elasticity up. And so a lot of people look at this as preventative maintenance. And if you do preventative maintenance, it's kind of like your car. If you truly do preventative maintenance, most likely you're going to spend long-term less money mechanically on your car. Same way aesthetically. If you'll actually put a little effort in, it's no different in our dental health or our mental health, all that. If we'll put a little effort in, we can avoid a lot of stuff down the road.
All right. Great conversation as usual about injectables as a solution for premature aging. Be sure to reach out to Dr. Kris. You can also listen to his podcast on all the stations out there where you can find your the one that you like to listen to. And also you can catch Dr. Kris on YouTube as well. So we're going to do the rollout, and here we go. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast.